entire calendar year of 2025 and that rolling 12-month period. And that improvement is sustained. So that performance trajectory across the autumn, where you see that uptick towards the back end of last year, has remained upward, ending the year at 95.5% in the month of December, and now is broadly stable, I would say, with a compliance rate of 95.6% for the most recently reportable month of February. And then when you compare the last 12 months with the previous 12 months, overall, it's fair to say there has been a very significant step up. So 94.3% for the most recent 12-month rolling period, compared with 90.8% for the previous 12. So a significant uptick in performance. And broadly, if we look at comparisons across the country and in terms of time, our current performance puts us around the 13th position out of the 43 forces. If we step back 3 years ago, by the end of 2022, our 999 performance was 42nd out of 43 geographical forces. So night and day in terms of performance. And just finally pick up a couple of specifics that you may question, Deputy Mayor. So the average answer time in February was 2 seconds. That's in effect instantaneous. And the longest wait time that you can see on the chart there of 3 minutes and 8 seconds, that was an absolute exception when the control room was deluged with 999 calls at once. Now, I can't tell you the reasons for that, but my experience is that sometimes happens when, for example, motorway collisions happen and multiple road users make calls. So overall, I think huge credit is deserved to the control room staff here, who are for the most part police staff. And as you can see, the performance is stabilised and they're doing a great job for the public of York and North Yorkshire, as you can see.
Yeah, and I was just going to just welcome again, as you pointed out, just how fantastic that performance is. I was actually with a number of the members of the force control room at a meeting with Unison on Monday evening. And again, just fantastic performance, and also just really understanding how challenging it is to keep that level of performance at that level, responding to the public that quickly. It means it's really stressful behind the scenes. They do an amazing job, but they're also managing to maintain a fantastic performance for the public. So yeah, huge thanks from me as well as from you. So thank you for that.
Thank you. Okay, so I think we can go on to the next slide, and this is same measures for 101 calls. So the 101 SLA performance is shown in the top graph, which broadly and perhaps unsurprisingly aligns with our seasonal demand across the year. And to pick off a couple of points from it, the 101 average answer time continues to fall in that medium-term trajectory, I would say. And in February, we achieved 87.5% compliance against our SLA for 101 answer times. The first calendar quarter of 2026, as you can see from the bottom left-hand table, has been very healthy so far, with our 101 SLA compliance sitting as a whole since the 1st of January 26 at 88.4%. And it's important to mention, this is all against a background of increasing 101 demand. Indeed, we're seeing by as much as a 20% uplift year on year. So the maintenance of strong performance in this area is good. The very high wait time visualized in the on the right of the chart of 1 hour and 15 minutes we've looked into, and that's believed to be a caller who selected QBuster. That's the software system that effectively calls back the caller if they wish to select that option. But sadly, the caller remained on the line, so that caused an exception in terms of the data. But again, a solid and positive picture there, and I'll pause there.
Brilliant. Yes. There are two things that struck me. One, thank you for adding the days of the week and the average answer time, because I think from the public's perspective, it's really useful to know when the particularly busy and less busy times of the week are, if there are things that they want to contact the police about in a non-urgent way. So certainly the weekends, definitely worth people being aware of that. And then just again, you kind of referred to it, but in addition to the 101, there is online reporting now, and I think, is there also online chat now?
There's not a full online chat capability yet, but there's you're referring to the single online home. So there's the ability to report crime and undertake a number of queries with policing, be it a query around firearms licensing, reporting not a crime but an incident, Obviously, crime reporting procedures are, will be accessible through the single online home. There's a variety of tools and online forms that can be filled out through that website, and that then reduces wait times. It's in many cases a far more prompt and slick service that the member of the public or the victim receives with an online service. So yes, we would always prompt people where possible to use the online, the internet webpage.
But it hasn't reduced volume via 101. In fact, my understanding from speaking to the control room staff on Monday was actually volumes are, as it says on the chart, actually up 20% despite the existence of online reporting. So the volumes are actually, the demand is actually significantly higher, but nevertheless the performance is being maintained, which is fantastic.
Thank you, and it's really important we understand why. So we are seeing perhaps an unseasonable uptick in demand for the month of February. February is normally the one of the least busy months in terms of demand and crime demand across the entire calendar. We've seen a little bit of a difference in that, not significant, but small differences do have an impact in terms of our demand coming in through the control room. So we're doing some work to understand the reasons for that and how going forward we continue to manage that in the best way we possibly can.
Brilliant. Yeah, we can move on to the next slide. Thank you.
Okay, so the next slide takes us to response times. And again, just to explain it for viewers, our response time SLA performance for immediate commitments in urban and rural areas is at the top of the chart across the last 12 months. And there's obviously priority response as well visualized there. First point to pick out is that firstly, across the entire year, compliance with the national SLA target for immediate commitments is, as you can see, consistently met. Interestingly, for the most part, that SLA compliance for the last 12 months isn't significantly impacted by seasonable demands, where, for example, demand increases across the summer months. It actually remains broadly consistent, and that is, I believe, testament to our resource modelling and resource management, which takes account of daily and seasonal fluctuations, so balances that out. And secondly, local SLA compliance for priority commitments being 60 minutes has been safely above 70% all year, and that long-term trajectory is generally, as you can see, upwards. And that's positive because priority graded incidents very often represent some of our more complex demand that we deal with. So I would say the strong and long-term improving position is positive. That short-term hit at the end down to 72%, I think, is a reflection of what we've just said, where we have seen slightly higher demand than we would have expected in February, impacting on that, but nevertheless remains that long-term upward trajectory upwards and above 70%. And again, I'll pause there.
That's great. No, I think you've clarified the questions that I had about the changes, and I don't think I've got any questions because you've answered them all. So thank you.
Okay, thank you. So I think we can go on. So this slide is around our antisocial behaviour volumes. And again, as with all of the other data sets, we're showing this in a rolling 12-month period at the top. And again, unsurprisingly, perhaps, the profile you see there, so low in the winter months, increasing from Easter to a peak in July, and then a downward trajectory back to Christmas, follows that typical demand profile across policing. The key point I want to highlight here is that ASB volumes across 2025 are actually 1%, 1.1% more than 2024, but 14% less than the year before. So whilst the long-term trajectory remains downward, in the short term, we have seen I would say, a stabilisation of ASB demand. And broken down by command area, we obviously have 3 commands in North Yorkshire Police. What we're seeing is a downward trajectory of antisocial behaviour across the county command. That covers Hambleton, Harrogate, Craven, the Dales. We're seeing a plateauing of demand in the city command. That's York and Selby. And as you can see, we're seeing an upward trajectory of 6.5% in the coast command. Scarborough, Whitby, that's very specifically linked to 2 areas of antisocial behaviour in Scarborough town centre, for which the neighbourhood teams have 2 problem-solving plans now in place to address those through what we call our 4 Ps approach. So focusing on preparation, prevention of crime, protection of residents, and the pursuit of perpetrators responsible for that. One of them is in the Armour Square area, the other is more in the town centre business district. So yes, an uptick in Coast Command. We have a well rehearsed and well led problem solving plan to address those particular cases. But as you can see, that overall long-term trajectory remains broadly downwards. And again, I'll pause there.
Thanks. Yeah, I mean, any increase in antisocial behaviour is either down to upticks in antisocial behaviour, or it's about increased reporting of antisocial behaviour. And we just how many of the additional resources into the neighbourhood policing teams would have been kind of on stream, as it were, during this period of time from the 1st of March of last year?
Forgive me, I would be completely guessing if I gave a figure on that, but very, very happy to take that away and look at that.
Yeah, I mean, it's really just to understand whether or not actually the uptick in having additional neighbourhood policing is actually potentially in the short term leading to increased reporting of cases. And then my only other question was really around prevention activity. So the slide talks about the problem solving plans in place on the coast. I just wondered whether there were wider plans or patterns of projects, for example, that you might want to target in the areas where early intervention and prevention might impact on particular pockets of antisocial behaviour, either on the coast or in other places.
Well, we do see themes in antisocial behaviour, and it's perhaps unsurprising that very often in terms of antisocial behaviour associated with the nighttime economy, for example, we see increased demand across our business district and our nighttime economy areas. That would be seen, for example, in York city centre, sometimes Harrogate, Scarborough, and again, there's some seasonality to that. So recognising that theme, there's a force-wide approach we take to that called Operation Eventide, which means throughout our classically busy times associated with the nighttime economy, and we would very often see that, particularly in the warmer months, very often where the weekend is abutted by a bank holiday, we have particular high visibility plans across the organisation where officers will, from other roles, undertake high visibility foot patrol activity in some of those town centres and York city centre across those really busy times where we see the obvious need for the pursuit of perpetrators in the form of high visibility policing, undertaking high visibility patrols for reassurance, addressing and very promptly tackling antisocial behaviour and criminality is an absolute priority. So there's very localised responses, and I've given an example of that in Coast Command with these problem solving plans. But you're right to ask, we do have, where there's a theme across the force area, and lots of forces will adopt this approach, we adopt an organisation-wide operation, assign it an operation name, and then think about resourcing it at that force level, if that makes sense.
Yeah, that's really helpful. And then I guess the only other question is in the kind of on a particular issue where it might be a place-based issue. So where I know you've had Clear Hull Build operating in certain parts of the force, beyond policing, so those other wider partnerships, just anything else that the force would look at in terms of if there was an uptick in antisocial behaviour and it was persistent and it was place-based, just what that partnership engagement might look like.
Well, absolutely. And the partnership engagement might take several forms. So firstly, in the pursuit of perpetrators and the prevention of crime, in the pursuit of perpetrators, very often a criminal justice disposal that involves a charge to court isn't the appropriate disposal. And by disposal, I mean outcome. So very often partners support us in what we call out of court disposals, where a diversion to another organisation or agency that might be able to divert the individual, particularly if they're a young person, from otherwise criminality is an opportunity. So that's where we work closely with partners, and we've got a number of schemes in operation, some of them with your support, Deputy Mayor, that we're able to divert individuals who may be at risk of criminality as a young person into those schemes. We also work with partners in the prevention and protection space. So if there's, for example, a physical aspect, where support from the local authority might be required to design out a particular issue. And that might be, going back to the example of the nighttime economy, that might be in particular improved lighting. It might be working with licensing colleagues to address a particular problem premises that might be fueling some of the antisocial behaviour. We will do that. So there's lots of ways under our 4Ps approach, as I described earlier. We will work with partners. I'm happy to give way to Amanda if Amanda wanted to provide some further detail, perhaps, to your
Fantastic,
question.
yes. Please come in.
So I was just going to say that we also, when it comes down to those local plans and local issues, that we adopt a multi-agency approach. So we have scheduled multi-agency problem-solving meetings within our community safety hubs with our statutory partners, where we look at how we can all support in resolving an issue for the community. And that brings in what our partners have to offer, as well as what we can do from a policing perspective. So we do take a holistic approach to how we resolve those issues.
Brilliant. Yeah, I was actually in Tadcaster this morning at the Tadcaster barn where they, that's youth provision in the centre of Tadcaster, absolutely fantastic resource. But they were talking about the great relationship they have with the neighbourhood policing team in that part of the region, but also the need for the kind of engagement from our commissioning side. So in my role, in terms of ensuring that we've got restorative pathways if there are issues to engage young people. So it really is about making sure that we're joining all of those things together, because ultimately public confidence increases if all of those things happen together, which is what we all want out of it. Brilliant. All right, we can move on to the next one.
Okay. So this takes us on to crime volumes and arrests. So the first point to highlight is that crime is down 3.7% on the previous year. That's around 1,700 or so crimes less. And then the notable reductions you see in the table to the top left, there are some I want to just pick out there. So burglary in other than in a dwelling. So what we're talking about there is commercial premises, offices, shops. As you can see, that's down 21.9% year on year. Burglary in a dwelling, a residential dwelling, down 5.8%. And this is a particularly interesting one. So bicycle theft, that's a particular challenge often in cities like York. That's down 25.1%. That's down to some focused problem solving activity to reduce theft, specifically in York, and also vehicle crime more broadly, down 15.2%, which includes theft from a motor vehicle. The notable increases that you see, was to pick off a few of those. So firstly, drugs offences. Drug recorded crime is almost only ever recorded when the police find someone in possession of controlled drugs, either for themselves or to supply to another party. And so the substantial increase that you see there is as the result of almost entirely focused proactive work. So that's a significant positive point. Robbery has increased for a couple of reasons. So firstly, the way we record robbery, particularly associated with robbery in retail premises, has changed. We now record more, so it's difficult to compare that with previous years. And in terms of personal robbery, like many forces, we have seen a number of offences where robberies have been committed by perpetrators using things like e-bikes and e-scooters. Again, we're doing some really focused proactive work to address that, and have made some notable arrests and positive progress and seizure of illegal vehicles. Just lastly, to pick up the bottom right table, our arrest numbers are slightly down on the previous year as a total number, as the slide shows. But when you offset that against the 3.7% reduction in crime, in real terms, our arrest rate as arrests as a proportion of all recorded crime has actually increased. And I think that's a consequence of better detection methods, better systems to support our detection methods, and improved investigative standards. And again, I'll pause there for any questions.
Great, thank you. Yeah, I mean, I think you can absolutely see the areas where there's been some real focus, and then what you can also see is that crime is constantly evolving, and the police will always have to kind of keep up with some of that changing nature of crime. I suppose I just wanted to ask about whether there is some of those the areas that have increased, so the drugs and weapon offences and robbery, whether or not any of those are kind of under the violence against the person, although that is a small increase, whether any of those you think are tied together, and whether or not they might be tied into potentially more serious organised crime, or whether or not actually I should be looking at these things in isolation from each other.
No, I think you make an important point. Lots of these crime series will undoubtedly be linked. So the acquisitive crime series, like the burglaries, robberies, theft of motor vehicle, are classically linked to drugs misuse. That's obviously linked to organised crime. So all of these do link together. I think violent crime is classically linked to serious and organised crime in particular. Some of the robbery will be as well, but yeah, many of those crime types listed there, the kind of 10, 12 or so, will all be intrinsically linked in some form, particularly where it relates to drug misuse and acquisitive crime.
Yeah, and then just a second question around the sexual offences data, and just whether or not there is any kind of indication how that might align with the obsteteria work that is going on across the force in terms of trying to ensure that there is a victim focused approach, or and whether or not that is contributing to a higher number, or whether or not actually there's just more offending going on.
I think under that data set, what we're seeing an increase of and an uptick in is firstly what we call non-recent sexual offences. That's sexual offences that aren't recent in nature. They're generally historic, in some cases very, very historic, where we're talking potentially decades, where an adult victim was at the time of the offence a child. I think my view is that's largely linked to an increasing confidence, particularly where a victim has previously perhaps not had the confidence to come to the police, now is seeing our victim-centred, suspect-focused approach and has the confidence to be able to approach us and report their crime to seek justice. So that's the first category. The second, I think, is online child abuse, where we're seeing an uptick in indecent images offences. That's often reported where the informant or an involved party may be in York or North Yorkshire, or the perpetrator may be in York or North Yorkshire. You'll obviously be aware of the challenge and demand that creates across the entire country. But I think under that sexual offences umbrella, it's in particular those two categories that we've seen an increase in.
Okay, so it's actually quite important within each category there is a whole different range of types of offences. And then just finally on fraud, just whether or not there is any sense that big decrease, because that is a significant decrease, whether that's likely to be a decrease in crime reporting, or people reporting things through their bank or commercial means and not necessarily reporting to the police.
It may well be. There's obviously the new report fraud approach for the centralised reporting of fraud, and not all fraud will be routed to an investigation that's conducted by York and North Yorkshire Police. It's a really complex area, and there may be a number of factors of why that's reduced to the extent it is. But my sense is that's the reporting mechanism and the changes that have prompted that.
And we did have an online public meeting that focused on fraud and cybercrime, I think. Oh, I can't remember if it was the last meeting or the one before that. But certainly if people want some assurance around how to report, those slides are still available, so that people should pick that up. I think that's fine for that one. If we want to move on to the next slide.
Okay, so this relates to crime outcomes, positive outcomes, or we might know as crimes that are cleared up effectively. So for the last 12 months, the rolling 12 months, and you can see the graph on the right, the table on the left, our positive outcomes are just over 17%. I guess most importantly, what you can see is in the graph, that long-term trajectory remains upward. And again, I think that's testament to all of the work we're doing and have done to improve investigative standards. By comparison, if we compare North Yorkshire Police with performance across the rest of the country, what we see is that we are the third highest now for charges and summons. That's where we decided that it's a criminal prosecution that's appropriate, and we charge the perpetrator or summons the perpetrator to go into the criminal justice system, and they go to court. So we're the third highest nationally for that, and we're the seventh highest for all positive outcomes, which include charges and summons, but also some out of court disposals and other mechanisms for recording a positive outcome. And that's for the year up to the end of December, which is the most recently reportable period. And as I said before, I think we can attribute those increases to improved performance information and management, better investigative standards. We're doing an awful lot of work to improve the quality and consistency of our criminal investigations, better resourcing of specialist investigations, where we've got a really keen eye on what's our resourcing levels of specialist investigators, what we would call PIP2 investigators, making sure that a crime that's serious in North Yorkshire Police receives the appropriately skilled level of expertise to be able to investigate it properly. But all of that said, we are determined under the Chief Constable's leadership to get better and better and better. And we are on a journey and still on that journey to significantly improve and drive further improvements in our investigative standards. And I'm really confident that will continue to improve our positive outcome performance.
Great. Just one thing really, in terms of the just public kind of assurance really, which is, you know, it is obviously fantastic that we're the third highest nationally for positive charges and summons, and all positive outcomes. We're kind of seventh highest. These are really, that's really good performance. I suppose just from a public confidence point of view, those numbers still feel relatively low in terms of a percentage. So I just wondered whether there's anything you could say that would reassure the public that that victims, you know, victims being heard, victim focused outcomes might take other forms, or whether or not, you know, what victims should expect in terms of outcomes and the kinds of different types of crimes and how they might be dealt with differently to get those different kinds of outcomes. I'm not trying to do down the fact that these are positive numbers relative to other forces. They just still feel relatively low from a public perception point of view compared to, say, you know, the number of people who might be reporting something.
Well, victims across York and North Yorkshire are entitled to a quality service. They're entitled to be listened, understood, to have a quality service, an appropriate investigation, the allocation of an investigator specific to the crime type that's being reported. So some of those crime types that you can see on that chart won't necessarily necessitate a specialist investigator. Some will. So as you can see on the list, some of the offences there, for example, robbery and burglary, we now mandate those in North Yorkshire Police will go to a detective, so they will go to a specialist investigator. Not all forces are in that position where they're able to do that. We are, because we want to give victims of robbery and burglary and acquisitive crime the very best service. Similarly, reports of rape and serious sexual assault and sexual crime, as is illustrated on the graph, those are routed to specialist investigators within our safeguarding investigation teams. So we've got structured across the organisation where we believe we need it for the crime types we need, the appropriate level of skilled investigator to be able to match the volume of crime that's being reported. So I want to just give confidence to all victims, you know, residents of York and North Yorkshire who are thinking about reporting a crime. We will listen to you. We will allocate an appropriately skilled investigator to your investigation, and we will do the very best job we can to seek justice for you and achieve a positive outcome. And, you know, there's some solid performance here, but we are determined to get better and better.
Yeah, thank you. And I, you know, that I don't want to, you know, I know how much work sits behind those increases in performance, so I don't want to kind of do it down. I just know that the public, it's really important that the public have confidence in these processes as well. And sometimes those outcomes, positive outcomes can actually be positive for a victim, and they might not count as a positive outcome on a crime outcome. But okay, that's fine.
Forgive me, the Soteria approach around the you know, victim-centred suspect approach, that goes for all of our approach. We're victim-centred and suspect-focused, and focused on seeking justice for victims wherever we possibly can.
Great, fantastic. Thank you so much. We can move on to the next one, which I think is stop and search. Is that right? Yeah.
It is. It's a bit heavy with data there. So let me just explain that. When we regard positive outcomes from stop searches, an arrest and or a detected crime not dealt with by arrest, if that makes sense, our stop search positive outcomes sit at around 30%. In other words, the find rate of something from stop search sits at around 30% when you pick up arrests, or if not arrests, where a detected crime is recorded. Important to also just emphasise there's significant scrutiny on stop searches, both in terms of the execution of the search itself and compliance with legislation, which for the most part is Section 1 of the Police and Criminal Evidence Act 1984. They're all body-worn video recorded. Every search that we do is the subject of a specific record. Supervisors review all stop searches. There is further dip sampling and scrutiny and assurance on their quality. And also important to point out, any searches by female officers on males or male officers on females only ever involve outer clothing in line with the most recent guidance, and we've confirmed that through these data sets. Just to pick up on a couple of anomalies here, we may have covered these previously when they've been presented. The graph in the top right indicates that 4 people who were under 10 have been searched. That's an administrative issue. In fact, one person who was under 10, they were 9, was searched, and they were actually found in possession of a bladed finger ring, which was obviously seized, albeit they were below the age of criminal responsibility. I think we may have covered that before.
I think you're right. We may have done. Yeah. Sorry, carry on.
And also the not stated category in self-defined ethnicity in the centre of the table at the top includes people who have declined to self-define, as well as those where it simply may not have been captured. I can't break that down any further, but it's important to just articulate that particular point. And I'll pause there for any questions.
Great. Yeah, thank you. Yes, I have asked about that before. So just, I guess, one wider point probably really just in terms of how this compares to other force areas probably, which is, I assume, but it would be helpful to understand the scale of the overall count of records, 2,317. How big is that compared to another force area? Because actually, I think in some ways the percentages become more significant, presumably in larger if you're stopping more people. And again, just in terms of those unknowns, unstated percentages, again, if I understood that in the context of maybe what a larger force who maybe stops thousands of people more than we do, whether or not that kind of percentage is relatively normal, or whether or not actually we're an anomaly in that space. That was just really to understand where we sit.
It's a really good question, Deputy Mayor, and if you permit me, we will absolutely seek the data from what we call our most similar group forces. These are forces that HMIC FRS have defined are most like us in terms of complexity, size, geography, demographic, where we can see how we compare to those 6 or 7 other forces, and we're very happy to bring that back next time and perhaps show that data against the sets we've got here. Great.
Yes, that would be helpful, I think. And then just on the not so much the under 10s, because you've answered that point, but all the under 18s, just really a kind of safeguarding question, really, in terms of what safeguards are in place for those young people who are being stopped and searched by the police.
Well, the guidance prompts us where appropriate to ensure there's appropriate adult present to support the execution of a search, if that's relevant to do. That won't always be practical or applicable in every circumstance, but again, there's clear guidance there, and we make sure that in the scrutiny and review by supervisors where they think the search is appropriate and is being conducted in line with legislation and all of the guidance, that they all of the specific details and mechanics of the search are picked up through that review template. So that's scrutinized through the supervisory reviews.
Okay, yeah, I mean, I again, I think it would be useful to have some comparison from other similar forces, because I would imagine their numbers of under 18s would also be significant. But again, it's hard
Yeah.
to make a comparison without fully
That's
knowing
likely.
where we sit.
Yeah, that's likely, and we're really happy to get perhaps the most similar group set of data.
Great. Yeah, we can move on to the last slide.
So lastly, yeah, a few points to pick up here on volunteers in particular. So as the chart says, we have 178 police support volunteers. And in terms of contribution, so the data set shows they contributed around 7,500 hours in 2025 alone, which is remarkable. And that includes, for example, volunteer drivers. We have cybercrime ambassadors. We have rural watch patrols. We have community speed watch, front counter support volunteers. There's many voluntary roles, and they play a huge part in North Yorkshire Police in keeping people safe. And we have another 25 being on board at the moment for driver and neighbourhood support volunteer roles. In terms of specials, our 64 special constables contributed around 24,000 hours in 2025 across a variety of roles in response teams, neighbourhoods, roads policing, other specialist areas. And we've recently undertaken a recruitment campaign for special constables to start in September this autumn. So again, we're hopeful to increase that number further across the force. And I think having an organisation with volunteers brings so many skills and experience from other sectors and their own professional backgrounds and lives into policing. It's really good for policing in terms of the skills that we can then provide, the problem solving that we can undertake, and it's good for the soul of the organisation itself. So I think that's a healthy position.
Yeah, great. And my only other question that I have been asking quite regularly is just around part-time working and flexible access to flexible working. And again, I'll just pick it up again because it came up at the meeting I was at with Unison on Monday. I guess I'd been thinking about part-time working from the point of view of women in the police force who might want to be returning to work on non-full-time hours as a police officer or as a police staff member. But actually the thing that came up on Monday was also people nearing retirement age or who are nearing their completion of their career who might also want to reduce their hours. So I just wondered whether it might be possible to have a better understanding of what the part-time offer is to staff, because presumably our volunteers are part-time already, and where that fits with I know what is complicated around shift patterns and things, but just really around that and just retention really.
Sure. Well, under our flexible working procedural guidance, staff have and officers have the right to submit what we call a flexible working request. That might be to undertake a number of options. It might be to undertake reduced hours. It might be compressed hours. It might be a job share so that the full-time equivalent role is still undertaken, but perhaps by more than one person. Those are really carefully then considered by supervisors. We always have to consider the operational requirement by the organisation because we undertake obviously a very important service. So we need to maintain that service delivery for all of the performance reasons that we've discussed. Again, I don't have the specific data on the numbers of flexible working patterns that we have in place at the moment, but again, that's something that we can certainly access.
Yeah, that would be great. Thank you. That was all on that one. Thank you. I think is that the end of the performance pack?
Yeah.
Brilliant. Thank you so much for that. We are going to move on to Inspector Reader's presentation, the thematic, which is about the early intervention and prevention activities. What I'd just say from the beginning, Inspector Reader, what would be really helpful is if there are things that you can caveat into how it all fits with the neighbourhood policing offer that I know we just looked at in terms of the numbers on the previous set of slides, but certainly one of the things that strikes me with early intervention and prevention is how it interfaces with the kind of neighbourhood offer that North Yorkshire Police have got. But I'll let you crack on with your slides, and I have got some questions as we go on.
Absolutely, no problem. So my name's Amanda Reeder. I'm one of the inspectors in local policing support. Part of our department is that we have teams within LPS who hold portfolios such as licensing and hate crime, who actively undertake the prevention and early intervention. But we also have portfolios such as one of mine in relation to neighbourhood teams, which is about delivering those national requirements. So, for example, ensuring that our neighbourhood teams are delivering the neighbourhood guarantee. So those elements of police back on the beat, community-led policing, the clear performance standards, the crackdown on ASB, the safer town centres, we helped to ensure that that's delivered by our neighbourhood teams. Part of that delivery comes through the problem solving, target activity and community engagement, which are key pillars of neighbourhood policing. So we have strong links into our neighbourhood teams from this centralised department. Because we know from evidence through College of Policing that strong neighbourhood policing links and strong community engagement increase public confidence and help with that reporting and that intelligence picture around who's committing crime and help us to solve it. Next slide, please, Chrissy. So we have problem solving within the department, which is a mechanism and a methodology for dealing with repeat incidents or locations and victims and offenders where we have a sustained and long-term issue that needs resolving. It's a partnership approach undertaken and documented through what's called the SARA model. So that involves undertaking scanning and analysis so that we can actually identify what root causes are. That might involve, in particular locations, being able to nail down exactly when and where things are happening, down to short time spans, so that we can actually ensure that our responses are targeted and meaningful. That part of those responses can come from national best practice, for example, that is proven to work, so that we know that we're implementing cost-effective means of addressing these issues. The assessment we then do prior to any closure of a plan, which looks truly at whether we've resolved the issue and whether we've addressed it, and that will often involve revisiting the communities impacted to understand if we've had seen an improvement in community confidence, or that the issue is truly resolved for the community and not just from our data reading. We share good practice in relation to problem solving internally through our neighbourhood teams and through our wider policing picture, because problem solving isn't just for our neighbourhood teams, although it is a big part of their role. So we have Problem Solver of the Month, where we identify good, effective problem solving that's been taking place, and we share that knowledge so that across the entire force we can take elements that we know have worked and have had success. So for example, in the previous slides it was alluded to, the York City Centre had a fantastic plan addressing cycle theft, so we can look at the elements within that have worked well, use the assessment and the evaluation that's come through the SARA model to share that across the force so it can be used elsewhere. We have an internal knowledge hub where we can share these things as well, and we're launching internal problem solving and prevention awards within the force in April this year, where we celebrate that good practice. We share the learning to make sure that it goes across all departments and all areas within the force. Obviously geographically it's very large, so it gives that opportunity to really share how it's worked and the detail behind it. An example just to touch on briefly there is in North Allison, we've had these plans are multi-agency. So where there's been issues within the community, we've done regular meetings and joint working with housing, through the community safety hub, with the council, probation and services such as Horizons. And that collaborative approach has allowed us not just to support the victim and to support and deal with the perpetrator, but to address those root causes. The end of that plan, we saw significant reduction in the reports that we'd received, but we also, through the surveying tool, saw significant improvement in community confidence from the community that had been impacted by that. And that is the key aim with our problem solving is to have that reduction in the incidents and that improved community confidence to truly resolve issues through that methodology. I'll pause there in case you have any questions.
Just a couple of brief questions. Thank you for that. One was just really to understand the kind of data that is on the dashboard, so the kinds of things that you would be inputting onto that. And then a second question was just really about the kind of the quality control really between different places. So if you have a multi-agency problem solving plan in Northallerton, how do you ensure that when there's a problem in, I don't know, Ripon or Skipton, that the level of response is broadly consistent? Because some of that will be down to how much those partners and stakeholders, how good they are in that place. So how do you kind of manage a level of quality control?
Absolutely. So problem solving has some national frameworks sitting around it as well in terms of the expectations of how we deliver it. So all of our problem solving plans are documented in that SARA model and recorded on our systems securely. And that will have the full breakdown of the actions taken and how we've resolved it. At the conclusion of that plan, I have a sergeant sits within my team who gives out tactical advice and support, but who then scores those plans against a national framework of what the expectations are, what counts as, you know, a clear reduction, what counts as a you know, as having sufficient partner involvement and for it to be resolved. And that's given an outcome which can be around a long-term sustained reduction. It can be an unresolved issue. It can be that we've seen some reductions, but there's other areas or that the problems move. So there's lots of different elements that we can see within that. And the point that is closed, we do that assessment. And we score the plans. So the plans are scored out of 30. So we can clearly identify from that problem solving dashboard, which is very much a means of us sharing good practice. So it gives the officers details, it gives the location of the plan, and it gives the type of plan. So if it's been in relation to antisocial behaviour, if it's been in relation to burglary or vehicle crime, it gives the type, so that then in the future, should I be addressing an issue in relation to ASB, I can have a look on that dashboard and see where we've had high scoring plans in relation to ASB, and then I can go and look up the specific details in the secure system to see what the nitty-gritty details were and actually how that's been resolved. So it gives us that database almost of good work where we can clearly pick out the high scoring plans and where they've been effective.
And not wanting to focus on the negative, apologies, but when you have a low scoring plan, and I don't for 1 second assume that that would be down to policing, that it would be a low score. It just, these are partnership kind of responses. But just in terms of how a wider partnership can be challenged, I suppose, is my role in this space to ensure that all those plans are high scoring and delivering what communities would expect. And how would I kind of, what would enable me to know if there were particular problems in particular places other than someone telling me, which they might. How else would I know if there was a problem potentially that wasn't necessarily being resolved through one of these plans?
So we can see where the problems haven't been resolved through the scoring system and the outcomes, and then we have mechanisms internally, if that's a police matter, for either providing training to address it or to address the performance of that plan owner. If it's in terms of partner involvement, then that's where we would use our heads of function on commands to speak to their peers within those partner agencies at that counterpart level to address it through our partners, and have that accountability there. Ultimately, our neighbourhood teams work with partners every day, and it's a a core part of that role. So those relationships are there to be able to feed back and through the governance and the meeting structures that they have.
Great. Yeah, fantastic. Thank you.
Okay, next slide. Appreciate some of the performance slides were relating to antisocial behaviour. So within my portfolio areas, we've had the Home Office funded patrols in relation to antisocial behaviour, which have been in place for 23-24 financial year and 24-25. This has been specific funding in relation to policing antisocial behaviour hotspots, with some criteria set from the Home Office in terms of how that looks in terms of delivery. So in the 24-25 financial year, we identified 20 hotspot locations with support of our business insight analysts to see where those key repeat locations were. And we have operated a system where we geofence those areas, and through the Home Office funding, the requirement has been to put high visibility officers on patrol within those locations for a minimum of 15 minutes at the peak time. So this has been a daily activity that we've run for the last 12 months in these hotspot locations. that funding is due to end, but is going to become a part of our day-to-day business of our neighbourhood teams, as it is already in a lot of ways, because they already have antisocial behaviour hotspots, and because the Home Office ones have been fixed for a 12-month period. As you can imagine, there are things that happen, and different areas outside of those locations sometimes come up as areas where there's experience of ASB. So they're already delivering this and using some of the tools that we've managed to fund through that Home Office funding in order to address them. But the methodology that's been used for the Home Office funding posts is high visibility officers on foot in those locations, engaging with the community, engaging with people who are in those areas, and we've captured their patrols through a system that we've purchased through the funding called VisiBeat, which allows us to geofence and track through officers' mobile phones the time that they spend in those locations. We can see that they're on foot, we can see where they've been. It's a fantastic opportunity for us to then, we now use that within our neighbourhood teams for capturing their problem solving activity and the work that they're doing in wider ASB activities. So just going back to within those 20 hotspot areas that we've been working on, they remain in place until the end of March when the Home Office funding ends. So they are patrolled pretty much daily. There are officers out assigned to these patrols on patrol plans every single day in each of the command areas. And we've seen some significant reductions in some of the hotspots. Some of them we've seen slight increases. And what we do at the conclusion of the financial year is we look at actually some of the reasons that might sit behind those reductions, and do the analysis and the assessment to see if the impact. Some of those increases are relatively negligible. So, for example, in Heworth in York or in Clifton in York, we've seen an increase of 3 incidents across the same 12-month period when we compare the same area. So, yes, they are increases, but not significant or huge numbers. But then equally in other areas, such as one of the hotspots on Micklegate in York, we've seen a reduction of 30 incidents within that time period. Equally, over in Harrogate, we've got one area in particular where we've seen 141 fewer incidents. That is a significant reduction. So we look at both the increases and the reductions to see whether it's the impact of the hotspot policing, whether there are other factors that have come into play with that. Sometimes it's a case of housing or a partner agency have moved someone, or a particular location's been developed, which has meant that people no longer gather there. So there's a number of reasons that can sit behind that, and we look to do that as part of the evaluation of this.
Thank you. That's really comprehensive, and I was going to ask about, but I think you've covered it really, just in terms of areas that didn't see the decreases. But I think you've kind of addressed that, because actually there will be a number of factors at play, and this is an evolving programme. Is that's basically what you were saying, wasn't it, in terms of what the public could expect from these kind of targeted hotspots going forward?
Yes, exactly. So the Home Office ring fence funding in relation to this has now ended, but the plan moving forward is that this is built into our neighbourhood teams as a requirement. We've proven the methodology. We've been able to purchase some of the systems, such as the VisiBeat system, that allows us to track and capture that targeted activity of our officers. And the tools are there now for them to be able to identify those locations and target them within their own areas. So the local neighbourhood inspectors, of which there's 10 across the force, now have ownership of actually the delivery of those ASB hotspots within their communities, and have the ability to use the data to identify where they are, and if necessary can move them, which is a significant part of it, because obviously for the Home Office ones, they were fixed for 12 months.
Just my only other point was just about the the permanence of it, really, in terms of how do you people need to report, presumably, for you to have the data to base your decision making on, and therefore I guess the message to the public is they need to keep on reporting problems when they occur, in order that the police can make the kind of tactical decisions that you are making about where to step up or step back in terms of levels of activity. Is that the right kind of assessment?
Yeah, absolutely. We will we monitor and do monitor all the incidents that happen in areas. Our local neighbourhood inspectors have ownership of their geographic area in terms of identifying issues that are going on there. But public confidence and reporting and letting us know what's happening is, of course, is key. As with ASB, often is reporting appropriately to Housing Authority and other partners who also have responsibilities around antisocial behaviour as well as police.
Great, thank you. We can move on to the next one.
So the school liaison team, so the school liaison officers are operating as part of the neighbourhood teams, but the centralised sergeant position sits within the department who looks at early intervention opportunities and also around developing schemes such as Operation Divan. Operation Divan is a scheme that was addressed or was launched, sorry, in 2018 with an aim of reducing weapon carrying among young people. So it's a non-criminal disposal, an educational piece around young people who are potentially either carrying a weapon or who we have received intelligence reports to say that they may be doing so. So those, the way that it works is that those young people, when they're identified, are if eligible under the Operation Divan in terms of that carrying of a weapon, are put through an educational piece to teach them around the risks and the harms and focus on taking that educational approach to teaching them and not criminalising them, but teaching them what the impact might be. We've done an independent evaluation for this through the University of Birmingham, which was concluded last year, where it was compared to a force that doesn't operate an Op-Divan intervention. And that evaluation found that young people who engaged in this programme, which is a voluntary programme where the parents obviously consent to them being involved in it, were 60% less likely to commit knife-related crime or to continue carrying weapons, and they had lower offending rates for any offending, not just for knife crime, than any of the match control groups. So that's a significant reduction from this educational piece. So bearing in mind that this is done also off the back of intelligence where we wouldn't even necessarily prove an offence, we've just got information that they might have, they might carry a weapon or they might be thinking about it. We deliver this intervention. So it's not replicated anywhere else in the UK at the moment. It's been raised as good practice and something that we are sharing actively with other forces. We don't get masses of them. We're talking about around 50 to 60 a year, and that data is quite consistent over the last 7 years. But to even see that 60% reoffending reduction is significant.
Just a couple of things on this slide. One is just a really assurance question really about the scale, because when you give something an op name, it implies that there may be these things may be kind of going on all over the place. So it's just some assurance around the scale. I also had a question about whether or not, great that this is being done with schools. My concern would be what happens for the children, young people who aren't attending school, in terms of barriers to accessing something like this. Just whether there's anything you're doing to ensure that children, young people who aren't attending school or are poor attenders of school, whether or not we're capturing them, and then just anything really about the scale and whether or not this is operating in primary and secondary schools.
So yes, so first of all, from a scale perspective, we deliver around 50 to 60 per year across the entire county. So we're not talking about significant numbers. It's less than one a day. We monitor exactly where they are and where they're occurring as well through our centralised team, so that we can see if there's potentially an area arising where there's an increase or there's any trends, so we can identify them, and actually, if necessary, we'll deliver wider assembly pieces or wider educational pieces to more year groups, although the Op-Divan actual delivery is a targeted intervention one-to-one with young people. In terms of if they're not in education, that isn't a barrier to them being in receipt of this intervention. So they will be delivered either by the school liaison officer at home or they will be delivered by one of our neighbourhood team who've been trained in delivering the input to them. So we will capture them even if they are somebody that isn't engaging in education on a regular basis.
Great. And just anything about primary, secondary?
It's delivered to either. There's no barrier around age. We deliver it in an age appropriate way based on the age of the recipient for it. It is purely designed to prevent them carrying any weapons or escalating in criminal behaviour.
Okay, brilliant. Thank you.
Thank you. Next slide, please. So this is another one of the operations that we use around children and young people. So Operation Choice and Operation Challenge are two similar operations that were designed having seen the impact initially of how Optivan was working and how well it worked. So Operation Choice is a process that's designed for children and young people who are found in possession of drugs and taking them through police-led educational systems rather than through the youth justice system. So it's been developed with that public health child first approach of trying to keep children out of that criminal justice system. It has led to about an 80% reduction in children and young people being referred to the youth offending panel over the last 3 years, where it's the primary offence is drugs possession. So it involves, again, the educational sessions and, where necessary, referrals into support services with our partners and diversion services to help those young people away from those choices that they're making in relation to drugs. In relation to, sorry, go ahead.
No, you go, finish your slide.
I was going to say, in relation to Op Challenge, this is a new one that launched in January last year, again based on that Operation Divan model. And this one is about using intelligence to identify future perpetrators in relation to domestic violence and toxic masculinity. So it's got a strong focus on that violence against women and girls, and we use a multi-agency input with those resources aligned to our VORG strategy to try and divert some of those opinions or those viewpoints that some of those young people have developed, and re-educate them into understanding actually what is an acceptable, or what is the a more acceptable viewpoint in terms of that approach to women and girls. So they're both designed as those diversionary options, where sometimes there isn't yet an escalation into that criminal behaviour, but where we can see that through our partners and through support and education, that young people are showing a viewpoint that perhaps needs to be addressed to prevent escalation into crime.
Great, thanks. Just on that last question, the kind of stuff around toxic masculinity, I just wondered really whether or not it ties into some of the wider work that may be going on in the Combined Authority across men's mental health, for example, or the mental health of men and boys, and also how you turn something that can feel negative into something more positive, in terms of people feeling valued rather than punished, in terms of how they feel about themselves. I suppose it's kind of all ties into that mental health piece. So just really whether or not there's anything in the commissioning space that we can be supporting in that, in the work that you're already doing. And then just on the drugs possession number, 80% reduction sounds great, but again, I just have a slight query about the scale, and whether that's an 80% reduction of a small number, or again, just in terms of public assurance, just about what the scale of numbers that we might be talking about there, in terms of the 3-year period, and again, just whether or not it covers primary and secondary schools.
Yeah, so again, just assurance that primary and secondary are covered in relation to all of these. There is the sort of line in the sand is under 18, so there is no sort of minimum age that will be delivered at age appropriate. And again, reassurance in terms of that not being a negative or punitive thing. This is delivered with all of these are delivered where there has to be engagement, there has to be consent, and it's around education and a positive viewpoint on it, support for these people to help them, and if necessary refer on to partners to give that additional support or mentoring services and other elements that we have through some of our commission services. So for these young people, it is a positive way of helping them to reroute the road that they're on, as opposed to a punitive measure. The design and the viewpoint is that it is that child first approach of what is best for these children, rather than treating them as perpetrators. Actually, how do we help them? How do we support them to make different choices? The team have had various training inputs that help them to be the right person to deliver those, to make sure that it's delivered consistently as well across the force, rather than have any nuances of actually who's delivered it. So we make sure it's a consistent service, and there absolutely is sort of that capacity and opportunities to link into that commissioning space and those commission services, because where possible we also try and make sure that that support or those referrals are also offered, and the team have an awareness of what those options are, so that they can make the right referrals and the right choices to support these young people.
Great. And the only other observation that I had was, I think the Regional Organised Crime Unit have some facilities is probably the wrong word, but they have some interventions that they briefed me on a while ago, and my worry with the way in which they talked about the work they were doing regionally was whether or not they are reaching the children and young people who most desperately need those interventions, and it sounds to me like these programs probably are reaching the children and young people that we absolutely need to reach, and it's just whether or not there's a way of tying in some of these operations with the regional organised crime work in this space, just to make sure that York and North Yorkshire probably gets a pretty poor deal from their regional organised crime unit in this space, because the demand in other parts of the wider region of Yorkshire and the Humber probably pulling quite a lot of them in. So just making sure that we're banging the drum to get their resources into our patch, to the right children and young people in our patch as often as we can. So again, if there's anything that you think could be happening or should be happening that I can help with, I'm very happy to pick it up with my deputy mayoral colleagues in other parts of the region.
Absolutely, I will happily do some checks to ensure that is happening, but I'm confident that this plugs a gap at that really early intervention and prevention stage, that prior to it becoming part of something that the ROCU would perhaps look at. It's a case of these are children right at the what I would deem the bottom end of that scale before they've got to that threshold point, and that is the aim with a lot of this, is to capture it really early to prevent them going into those systems in the first place. So we would aim to address a different cohort to what almost ends up in those places, and hopefully stop it upstream.
Yeah, brilliant, thank you.
Next slide, please. The designing out crime officers, I will not labour on this point too much, because I appreciate it was in the Assistant Deputy Chief Constable's presentation. So there are two designing out crime officers in the force who work within local policing support, and they work with developers, architects and planners to design out crime from the first place. It is obviously within the name. They'll provide advice on lighting, layout, access points, recommend security standards to prevent crime from occurring in these developments. So right at that early planning stage, they'll make recommendations to all of these developers and aim to stop the issues arising in the first place. They generally deal with around 50 consultations each month, making recommendations on them. And interestingly, that secured by design gold standard. So they will recommend secured by design standards as the most effective products for use in buildings, for example, in relation to doors and windows and security standards. the police CPI have commissioned some evaluation of that, and it shows that if the gold standard secure by design is adopted, then actually there's up to a reduction of up to 81% in attempted burglary, between 75 and 91% in residential burglary, and criminal damage by over 50%, and vehicle crime by over 40%. So actually, these recommendations they make should, to these planners and architects, when they are adopted to these standards, there is significant reductions in that long-term crime within the area.
Brilliant. Just very briefly on that, just is that work in terms of the designing out crime, is that work that they would be doing, those officers, with community safety partnerships or with planning authorities? Who's the main kind of lead partner in that space?
So the main work comes in through council planning departments to them for those consultation phases. So it's right at that planning stage that they do that. So they're both staff member posts, and have regular upskill in terms of their role, to make sure that everything that they are delivering is the most recent advice and guidance in order to prevent that crime in the first place.
Great. Yeah, fantastic. Thank you.
Okay, next slide, please. So the harm reduction North Yorkshire Drugs Analysis Project is a partnership of North Yorkshire County Council, City of York Council, Police and York University, which is a local authority funded project. And the aim with the NIDAP project is to identify the illicit substances that are circulating within North Yorkshire quickly. So an example, just as to how it works, is that there was some drug-related deaths in Rydale linked to some tablets that contained nitazines. Some matching tablets were located in Scarborough that were actually initially thought to have been Xanax tablets. They were tested promptly through this NIDAP scheme and identified as having the nitazines within them, and as being from the same batch as the ones linked to the Rydale death. So actually that had a significant impact then in terms of actually identifying the perpetrator for it, and very likely in reducing future drugs deaths in those locations, because nitazines are obviously extremely potent. So it's a significant project that helps identify those drugs that are present within our county and take a coordinated preventative approach with our partners to be able to reduce that harm. So it's a really strong piece of work. The future plans with it, the funding is continuing, is to explore those new opportunities to strengthen that partnership with the university. And we're looking at actually whether it can be expanded to testing vapes to understand risks within what are contained within some of the vapes that sometimes end up in schools, often raise issues around vaping and not knowing what's within them. So actually being able to test them gives us a better understanding of what substances are out there in our communities.
Yeah, and similarly I assume when you say nighttime economy and VORG related, do you mean spiking related
Yes.
offending? Yeah.
Yeah.
Just, I suppose my only question on that slide, I mean, it's actually quite reassuring to know that that's kind of what's going on in that early intervention space, but just really what how comms interfaces with that when you identify an issue like the one in Scarborough, what happens then to ensure that people are kind of made aware of it as quickly as possible?
So that's owned by our colleagues in public health who are part of that partnership. So they use that information to decide at what level and to whom that needs to be directed out to, in order to safeguard the people who are potentially going to be affected by it. So that element of it is assessed and managed through our public health partners, who are a key part in this partnership.
Okay, great, thank you.
So just continuing on in relation to harm reduction, we have trained 338 officers in how to use and in carrying naloxone across the county. So naloxone is a fast-acting medication that's given as a nasal spray that reduces the impact or effects of an opioid overdose. So it can truly save lives. If somebody is overdosing from an opioid, then the officers have the ability now to deliver the naloxone through a nasal spray, which can very quickly bring them round We've had 46 administrations of it since it was launched in spring 2024, and over half of those are believed to have actually saved lives or certainly had significant health benefits. It's probably worthy of note that there is very little negative impact of delivering naloxone. If it turns out it's not an opioid overdose, there are very few side effects, and it's a very safe drug, but it avoids having to wait any lengthy times for ambulances arrival, and it means officers can act quickly to actually save lives of people who are suffering from overdoses. Just in terms of Ketamine Awareness Week, so this is scheduled to take place in the summer of this year. So there's a national trend in relation to rising ketamine use, and locally our partners in public health have seen a rise in potential ketamine use through information that's coming back through colleagues within the public health service around some of the side effects of longer term ketamine use or from extended ketamine use, which is being raised to them. Part of that is things such as where GPs might raise some of the side effects of ketamine use, which I think have been publicly put in the news in recent months around bladder issues and stomach pains that are sometimes treated as in a way of like IBS, whereas actually it's from ketamine use. So there's educational pieces going on as part of this Ketamine Awareness Week around actually identifying those side effects and correct support for those individuals who may be using it. We're involved within that as well, from actually where that intelligence picture comes back about our disruption and what we need to do to identify where our supplies are and our target audiences are. And then in relation to drugs related deaths, we have seen a significant decrease in 2025. There is a delay in terms of coroner's data, so we only have it up to 2025, but there's been obviously 2 years where it's been 51 and 50, and then we've seen a reduction down to 32, which in part may well be due to things such as the ability to deploy naloxone, and in terms of the NIDAP and identifying drugs trends with partners and being able to get the messaging out there to make people aware of things like nitazines and support the people who are using those substances to avoid certain batches that may be circulating in our communities.
Just a couple of, they're not directly related to the slide, which is that the slide is really clear. Just a couple of things that it prompted, and that is really encouraging news about the naloxone, which I had in my bag. I haven't got it in this bag though, which is kind of defeating the point. Which someone gave me a couple of years ago for exactly the same reason as you said. It doesn't really have a downside, but it does have a lot of upside. Just question about testing on arrest in terms of identifying potential drug related criminality that might require a kind of low level intervention in terms of, again, just commissioning services and just whether or not we're identifying all of those drugs, and if people are at the point of entering the criminal justice system potentially. And then another one that someone mentioned to me, which isn't really drugs related, but I'll mention it on this slide because it does relate to arrest, and is just around footwear impressions. And where that fits again in that harm reduction, probably not so much in this early intervention space, but slightly further down the track at the point of arrest. I don't know whether that's something that you can address here or whether it's something we ought to come back to at a future point.
Unless the boss is able to answer, it would be something that I would have to come back to.
If I can step in, firstly on the drug testing on arrest, that's an initiative we're about to launch from the 1st of April across our custody units. And again, we've managed to secure the funding for the length of a year to be able to trial the impact of that. And you've been supportive of us doing that and provided support for that. Not all police forces do it. Some have done it historically and are now moving away from it for funding reasons. But we are about to start trialing that, so we'll see the impact of that. And as you say, Deputy Mayor, that the value of that is then supporting diversions for those people where there may be good cause to keep them out of the criminal justice system, and to try and divert them away from drug-related criminality. The second, I think you talked about footwear impressions. We're investing in some equipment called Tread Match, which will enable us to do that electronically. So at the moment, it is rather traditional in the form it takes, which is rather like a fingerprint being taken, but for a
That's the image
shoe
I
print.
had.
Absolutely. So we're effectively making that simpler, more straightforward, enabling us to get better hits through it. And we are using a system called Tread Match, which other forces have invested in. So hopefully there'll be some positive outcomes in both of those areas.
And just in terms of that footwear impression, sorry to put you on the spot on something that's essentially about drugs and this isn't, but presumably that's for different types of crime. Is it retail crime and burglary potentially? Yeah.
Absolutely, acquisitive crime, particularly burglary, actually, because of the nature of the crime and the trespassing element, where frequently footwear impressions may be secure, but that's something that through Tread Match we're investing in.
Brilliant. Okay, apologies, Inspector Reader, the floor is back to you.
That's all right. Next slide, please, Chrissy. So in relation to hate crime sits within the local policing support department. So the sergeant within that team has delivered hate crime awareness training to all of our police officers to help them recognise hate crime and that quality of service in terms of what's required. The team actually review all hate crimes that we receive to make sure that there's best practices being followed firstly, and that the victim is receiving the service they should receive, but also to identify any trends where we may need to do inputs within the community or support particular communities who may be feeling vulnerable if there has been an increase in any sort of reporting. We also contact every victim of hate crime to assess the service that's been provided and ensure consistency. So that allows us in real time to address any issues that they might be having and to get in early in order to gain best evidence and intervene to understand what is going on and whether we need to do anything as a more trend-based issue as well. The hate crime team also do a lot of engagement with different communities within York and North Yorkshire to reassure them and to encourage hate crime reporting, which links back into that community confidence aspect of it. It's obviously really important for people to feel confident to report to us the crimes that they're suffering and to divulge that information to us. So that's been involved, and there's also recently been a hate crime awareness course introduced to help us do education for offenders in relation to it, which is obviously a key in terms of that prevention of future recurrence in that education piece. Just in terms of the numbers of hate crimes and that we received, so in 2024 there was about 1,131 hate crimes reported across the whole of the county. 2025 that was around 1,299, so it was a slight increase, although that increase is believed linked to some of the more national issues that have been arising around asylum and immigration. So the hate crime team monitor, as I say, those trends carefully to make sure that we're engaging with those communities, that they feel supported and they are supported, as well as the wider hate crime element to it.
Great, thanks. Just really on the every victim of hate crime support line in that slide, just how and what that means for people who report what is then determined to be a non-crime hate incident, if that's the right if I put those words in the right order, a non-hate crime incident, is it that way around? Just whether or not there is support for those people, regardless of whether or not it's being treated as a hate crime, because actually they may still perceive themselves to be a victim, even though the crime itself is recorded differently. And I think, am I right in thinking that hate crime awareness course is delivered by Restorative Solutions?
It is indeed, yeah.
Yeah, and then just finally to add, just because you maybe aren't aware, but we have put together a web page of all the sources of support, both in terms of how people report, to encourage reporting, but also to ensure that regardless of whether or not people report, they can still access those services that are there through our supporting victim services, around cope and kind of recovery services for people, regardless of whether or not they've reported or whether or not something is a hate crime or a non-crime hate incident, or it doesn't matter, because if people feel like they're victims, they may wish to access that support anyway, and just to let people know that that is available now, and we're hoping to ensure that we're actually putting the data on there regularly as well going forwards. I don't know whether you've got anything you wanted to add about those non-crime hate incidents.
Just that the obviously the team of that specialist subject matter expert knowledge, so they contact the victims and they give that support on both sides of the scale. So how it is end recorded, it is almost it does matter, but it doesn't in terms of the support that's given to the victim, and they give that specialist knowledge and the referrals and the direction to the relevant support as well. So that is done for all.
Great. That's great. Thank you.
Just in terms of spiking, I know we touched on this earlier when we were talking about the vapes. So spiking in terms of sits within the police licensing team. So they have done some upskilling work with our frontline officers and our control room staff around recognition of spiking incidents and that response. We know that a prompt dispatch and a shorter timescale between obtaining urine samples is likely to be able to capture whether something's within someone's system or not sooner. So we try and make sure that we do it right first time in terms of that response and adhere to the sort of national standards in terms of those expectations around, for example, not diarising appointments and making sure that officers attend. We do quite a lot of preventative work in terms of this around that public engagement. So, for example, we know that some of the reportees come from higher education settings, so we make sure that we deliver spiking awareness inputs to those new students within some of the places, like, for example, York University, so that they understand what it is to be spiked and to understand about reporting it. And actually, we've seen from some of the work that we've done in terms of that engagement sphere that there's been an increase in the reporting confidence of those individuals once they've received that input and understand that the support is there and that we understand what's going on in that field. In terms of a reassurance, I suppose, of numbers, we get round about 150 reports per year. All of those are reviewed and looked at, and we're actually doing an audit of the last 12 months at the moment, just to go through exactly alignment to national policy, alignment to investigation and standards, and make sure that we're capturing all the opportunities that we are in order to detect these offences, and that will help inform where we need to either do further educational pieces or further work, or if necessary tweak or change our policies to make sure that we capture as much evidence as possible in order to do it. We also look at through our licensees and our nighttime economy aspects, making sure that our licensees are upskilled in identifying spiking incidents and what's expected and required of them in terms of that crime prevention aspect or that resolution aspects. So our licensing team work alongside them. So, for example, where we've identified there were 3 incidents that were in a relatively close or proximity that occurred similar dates, we were then able to engage with the licensed premises near those areas to highlight it to them that it was potentially taking place within those premises, educational pieces with the staff that work there in order to prevent recurrence and prevent any further offending. So that work is ongoing at the moment in terms of that audit piece, which will hopefully give us some good learning points, both of good practice and areas where we wish to develop it further.
Great. You've given me the reporting numbers, which was going to be one of my questions. Just I guess the other questions I had were about what assurances you can give people around reporting, but also just, I suppose, the range of ways in which this currently happens without being too alarmist.
Yeah, the range in which can happen is that spiking captures a whole host of different ways of doing it. So there are reports in national media around potential needle spikings where somebody might be injected with something, although those are far less frequent. What's more often is that drinks are spiked, generally on nights out, or sometimes we've had incidents of vapes being spiked, which is partly linking back to that piece around NIDAP and around how we assess and evaluate those vapes as well. The mechanism for testing is a urine test. I suppose that would be my other thing to from a reassurance piece, is that it's not an intrusive investigation in terms of how we identify if that's happened or not. It's not blood test, for example, it is a urine test. And just that it will be taken seriously, that it's important that we understand what's going on and that it is reported.
Yeah, no, absolutely. And are there times of year when this is more prevalent? And does it, and my instinct, which is that it affects the student population more, that may be wrong, but any clarification that you can give me about that?
The audit will draw out that full evaluation piece, although we do targeted work within those higher education settings, because we do tend to see a slight increase when there is, for example, new students coming through from September time. So, but the audit will be a full audit in terms of, or is a full audit in terms of actually exactly when and where it happens and who is reporting.
Great, thanks. And then just finally, I don't get the impression that this is anywhere near where these slides are, but just a kind of sense check that we're not sitting anywhere near the victim blaming space of this, in terms of I know there's quite a lot of preventative measures that sit in that kind of, keep your drink covered, don't do X, Y, and Z, and actually that does tread in my book quite close to blaming victims for being spiked when they're not the ones doing the spiking.
No, not at all. It's about identifying perpetrators and people who are out of place, or, for example, raising awareness to bar staff in terms of suspicious behaviour from offenders, and trying to locate or identify who they are in our communities, rather than blaming our victims or expecting them to change their behaviours. This is about identifying perpetrators.
Exactly. Okay, great. Thank you.
And I think this is the final slide, just a wider piece in terms of our licensing. So our licensing team work really hard in terms of those key licensing objectives of preventing crime and disorder, ensuring public safety, preventing public nuisance, and child protection. So those are the key elements that link into everything that our licensing team do and our licensees should adhere to. So they work alongside roads policing in terms of identifying intelligence-led priority locations for drink driving, which comes under op limits. There's also work that they do in terms of that prevention around youth alcohol theft and then social behaviour that's linked to it. So this is an example where within our data we identified that there was an issue with the theft of alcohol by young people and drinking from a particular location, and our licensing team worked with the neighbourhood policing team in terms of addressing this, both in terms of identifying with the licensed premises their obligations under those licensing objectives and making sure that they understood their requirements to protect those children and to prevent crime and disorder, in supporting our neighbourhood team in actually getting to the root cause of the issue, and then supporting those young people that were identified in actually changing behaviour and diverting them away from that alcohol. So they work really hard across the board, not just in terms of dealing with applicants for licenses or issues with licensed premises. They also work alongside our neighbourhood teams in trying to do some of that preventative work as well. They deal with all sorts of inquiries to our licensing team that come through. Partly that's changes to licensed premises to DPSs, but also they review all temporary event notices. We get around 3,500 of those a year. So the team review every one of them to make sure that they adhere to legislation and that they're appropriate and that they're not going to go against any of those licensing objectives. So actually a lot of it is around that preventative space of ensuring that any licensed events that are going on don't cause crime and disorder, don't impact on public safety or child protection issues, and don't cause public nuisance. So it's that preventative work that goes on to make sure conditions and legislation is adhered to stop it impacting negatively on our communities. And where there are issues, they work quickly to deal with that. So, for example, if there's issues with designated premises supervisors, they'll take swift action in order to have them removed. If they need to review licenses, then they will take people to review, working alongside partners in City of York Council and in North Yorkshire County Council to do that.
Great, thanks. Mindful of time, but just a couple of very brief things. TENS, is that temporary event notices?
Yes, it is. Yeah, temporary event notices.
Why is a rise in those a concern?
It's not particularly a concern. I think it's just that it's something that is a challenge faced within our team, of that we definitely see a rise in them and more of them being applied for. They can be for any number of things. They can be where there's ad hoc festivals and things like that, but they also get them. It's usually a peak sometimes as we build up into Christmas, of even where there's PTAs that want to be able to provide alcohol, so they need to have temporary event notices. I applied for
one for my mum's 80th birthday party.
Absolutely.
So I'm sorry to be contributing to the statistics.
It isn't an issue. I think the key thing to come out of it is that they are looked at and they are reviewed to make sure they meet those licensing objectives.
Great. And then just finally on the op limit, and just I'm kind of assuming that interfaces with the road safety partnership, but if you could just clarify that is an operation that is kind of run in tandem with wider roads
yes,
safety.
It is, yeah.
Yeah, great. I think that was all I had on that slide. Thank you so much for your presentation and for those slides. It's really good to be focused on the early intervention and prevention side of things, rather than the kind of consequences which we often pick up in these meetings. So thank you so much for talking us through all of that, and feel free to stay for the remainder of the meeting, but don't feel obliged. I don't know whether Acting Deputy Chief Constable Mosley will be offended if you leave, but I will not be offended if you leave after your presentation. But thank you so much. It was very comprehensive.
Thank you.
Thanks, Amanda.
Great. In which case, I am now going to ask some questions under the spotlight section very briefly, and then we'll move on to the third party report section, which I think we're going to look at the Angelini report in. Just very briefly, just a question about the preparations for the summer, and just whether and how the force is preparing for the kind of annual uplift and uptick in demand, which happens every year in York and North Yorkshire. Just anything you can add on that, or whether or not that's something that we could just have some additional assurances around.
Thank you, Deputy Mayor. The first point in that is understanding our demand, and we are blessed with some great data sets. Our understanding of our demand on a day-to-day basis, week by week basis, and crossing all seasons is really detailed and thorough. And so from that, we're able to understand exactly where our demand is likely to increase across in particular the summer period. As we saw earlier on the typical demand trajectory on many of the performance metrics, what we see is now an increase over the Easter period, and again much of this is logical, an increase over the Easter period, then a steady increase towards the summer, peaking around July time, and then tipping off back towards through the autumn, back towards Christmas, and then down into a low point for January, February, and the early part of March, so across that winter season. So we've got really good data understanding of what our demand is over that period and where it is. Earlier today at our force performance meeting, we were discussing our plan for how we ensure there is resilience across the force, so that where we see the obvious demand increase, particularly associated with tourism, in our city centres, in York, in Scarborough, in Harrogate, how we manage that. And I think for the most part, that's around ensuring we still have that local community-based neighbourhood policing approach, supported where necessary, in particular across busy weekends, and with our Operation Eventide approach, where we support the nighttime economy policing activity, supported by officers where appropriate from other functions, to make sure that we've got sufficient resourcing for those demand increases.
Great, thank you. And then my next question was around a completely different topic, around the sensitivities around arrest and neurodiversity, and just if there's any work that the force is looking at in terms of neurodiversity when people are arrested, and how to be sensitive whilst doing your job and upholding the law.
So within our custody estate, last year we undertook a programme of improvements across all 3 custody units. We have 3 custody suites based in York, Harrogate and Scarborough. And part of that improvement plan included the consideration of physical features within the custody units to support those young people, those with the neurodivergence, and other elements to relax people, to enable us to do our job, to deal with perpetrators of crime, but in the most appropriate way, in line with the authorised professional practice that the College of Policing provide, and all the guidance that we have to understand the best conditions and the best features that we're able to introduce within our custody units, and that includes support for those with a neurodivergence, and that is in terms of the colouring of cells, the methods and means by which we can relax people, make very clear the circumstances for which they have been arrested, so that they're really clear and understanding of the circumstances and all of the support that can be provided to them.
Yeah, great. And I suppose that, ultimately though, the bottom line is there's a public safety element to some of this, and if someone is a risk to someone else or to themselves, that the police, that will be the primary still motivator of the interventions that the police will be making.
Yeah, exactly that. Yes.
Okay, great. I think we can move on to that third party section, if we've got the slides for that.
Okay. So I just wait for the slides to go up. There we go. Okay. So I'm conscious of time, so I'll move through at pace with this. So there are, as this slide says, 4 individual reports referenced in this short slide deck. So the Part 1 report, published in 24, in short, looked to understand the basic history surrounding the career and conduct of Wayne Couzens. The Part 2 report, published in 25, looks specifically at the extent to which existing legislative measures protect women and girls from harm in public spaces. In simple terms, the second part of the Part 2 report, which is due this year, will look at the extent to which recruitment, vetting, transfer arrangements for police officers, and other elements are able to sufficiently identify those who have a predatory and or a misogynistic behavioural trait, and the extent to which there are systemic cultural issues that are prevalent in policing. And then the Part 3 report will look at specifically the recruitment and vetting and management of David Carrick. So that's just an overview of the 4 types of reports relevant to this input. And then I think if we go to the next slide, this starts off with the Part 1 report, which is listed there. So again, if I just give a very, very brief summary of where we are against the recommendation. So the first recommendation in simple terms relates to forces ensuring there is a policy on investigating sexual offences. That is complete. There is a published policy and ongoing assurance work that takes place that reports quality to our vulnerability board. So we're in a good place there. Recommendation 6, which is the next one on the table, as you can see, relates to the review of any indecent exposure allegations and sexual offences recorded against officers across the country. What we've done is a full audit that's been taking place for all officers and staff. We don't have any officers or staff with an indecent exposure disposal, such as a charge or conviction or caution for that offence. But separately, what's called a national continuous integrity screening tool is being expected this year, which will automatically identify any officer who becomes the subject of any such allegation without what we call a PND check, a police national database check, being completed. Recommendation 7 relates to the completion of in-person interviews and home visits in recruiting. Now, we already undertake in-person interviews for all candidates, as you'd expect for police officers, but we're awaiting guidance on the second matter of home interviews. That'll be published in guidance by the College of Policing. There is a trial being undertaken in the Metropolitan Police in Greater Manchester at the moment, and we'll await the outcome of that and then the publication of the guidance. And then the last line here relates to recommendation 8. That's all around recruitment and our vetting policy more broadly and the use of psychometric assessments. Again, for us to fully complete that recommendation, we'll need to await the delivery of some national work on an agreed psychometric testing tool. But in the meantime, North Yorkshire Police put all officers and staff through the Police National Database on a monthly basis. We call that Operation Prism. We're the only force to do that. What it means in simple terms is we would always pick up whether or not an officer has any intelligence or any allegation or criminal disposal recorded against them by any police force or law enforcement agency in the UK. We'll obviously also await the publication of the new vetting guidance, where certain offence disposals will serve as automatic bars to a successful vetting and recruitment process. That's probably enough there on point 8. So unless there's any questions, I'll...
Very small question. What's the difference between completed and closed?
So, right. So when we close down recommendations, we go through a governance process for that. If there's a public report where there's a formal HMI recommendation, that has to be closed by HMI. So in this context, completed is completed, closed is yet awaiting the governance process to finally sign that off and close that particular recommendation down. It's a reference to our internal governance process for closing down recommendations, if that makes sense.
Yes, that's very helpful. Thank you. And then just a kind of, I guess it's a more general point, really. I mean, it does sound like the force are doing some really important kind of work and getting ahead of the curve. It was just a wider point, really, in terms of whether the force, either the force or whether nationally, there is some stress testing of these recommendations in terms of whether or not there are workarounds that people could use to get round those expectations, and whether or not we're doing any of that as North Yorkshire Police, or whether or not that's taking place nationally as part of wider assurance work. Certainly I would just want a level of assurance, a bit like you would in terms of a law. If you were bringing in a new law, what's the workarounds? What would the criminal mind be doing in that space? I suppose it's just, how are we testing these recommendations with that mindset?
Yeah, it's an absolutely valid question, and you'll see lots of measures and provisions on all of these slides that we've introduced to make our processes as robust and as focused and as effective as possible. We've obviously relatively recently been the subject of a vetting inspection, so all forces are the subject of a vetting inspection by HMI CFRS. We were graded as good. I think we're the only force so far to have achieved that grade, which is testament to some of the effectiveness of the processes that we put in place. But as these new provisions and measures are introduced, it's absolutely on us to make sure that our systems remain robust and focused, and we're able to identify those that might try and subvert any process that's been put in place for a vetting purpose. So it's a good question.
Exactly.
We're absolutely alive to that, and we'll continue to do so.
Brilliant, thank you. Yeah, we can move on.
Okay, so I think if we go on to the next slide, yeah, all right. So this slide again talks to the Part 1 report. So in terms of recommendation 9, this requires forces to, as it says, demonstrate professional rigour with regards to vetting decisions. I've already just described our vetting inspection where we achieved good. And so the approach we've taken, I think, has received that endorsement, but we can't finalise that recommendation until there's further national progress on the development of a national vetting capability for investigations and decisions, as it says. 10 relates to the arrangements for the transfer of vetting information from one force to another for transferees. That is complete. And then 11 relates to improvements in the ability of forces to effectively share vetting failures for potential applicants. We comply with this as far as we can, but again, full completion of the recommendation can't be achieved until that national solution is delivered to support it.
Great, that's a good position to be in.
Yeah. Okay, I think we can go on.
Yep.
And then here again, staying with the Part 1 report, all of the remaining recommendations, as you can see on this slide, have been completed, so I'll summarise them very briefly. Recommendation 12 relates to the instruction to police officers and staff that by virtue of their roles, they can be subject to vetting to varying levels. That is intrusive, and it does mean their personal circumstances, again to varying degrees, depending on the vetting level that's required, have to be shared. That is complete. Recommendation 13 relates to the ensuring of change of circumstances are being correctly and promptly recorded and reported, and that randomised revetting is completed. We've got a number of measures to ensure any change of circumstances is very rapidly reported to our vetting team, and if necessary, a revet can be conducted. Recommendation 14 relates to the demonstration of a commitment to an anti-racist, anti-misogynist, anti-sexist culture. We have actively progressed our police race action plan work alongside, as it said, an internal call it out campaign. That's in place to report adverse behaviour by colleagues. The establishment of a diversity, equality and inclusion board to oversee all of that activity, and ongoing organisational cultural surveys. So that's complete. And finally, recommendation 15 relates to the ability of officers and staff to report inappropriate behaviour by colleagues, and we now have multiple channels in place to do that anonymously if appropriate. So I'll pause there for any questions.
No questions on that slide. Yep, that's great. Thank you.
Okay, so that takes us, I think, to the next slide, which is the Part 2 report recommendation status. So recommendation 21 relates to the rollout of Operation Vigilant. That, in simple terms, is a high visibility operation conducted for the most part by police officers in plain clothes, but also uniform, to make public spaces safer for women and girls, particularly focused on nighttime and economy locations across our force area. We have implemented Operation Vigilant. We are planning operations this year alongside and in support of Operation Eventide, which I mentioned earlier. And that will in particular focus activity across weekends where our nighttime economy areas, our business districts are naturally busier. And so that recommendation remains in progress while we just further embed our approach throughout 2026. Recommendation 23, as it says, relates to the prioritisation of sexually motivated crimes against women and girls in public places. We have violence against women and girls as a top organisational priority reflected in our control strategy, which ensures we focus on certain crime types and themes throughout the year. We monitor violence against women and girls performance in terms of criminal justice outcomes and investigative quality through multiple governance forums. And we undertake numerous assurance activities regarding our investigative and safeguarding approach to VORG. Again, that's very heavily governed. So we're absolutely committed to improve and further embed our improvements that we talked about earlier. And then finally, the last recommendation here, 24, relates to the implementation of Soteria. That's the victim-centred, suspect-focused approach in tackling serious sexual offences. We are an adopter force. We have a specialist team leading on the rollout of Operation Soteria. That's a long-term programme of activity, and that continues. And I think that's it.
Brilliant. Sorry, I'm going to just just ask a question about number 23, just in terms of I'm just trying to see if it's already on the slide, but in terms of working with partners, particularly I'm guessing kind of licensed premises, the universities, colleges, just again, anything that the force is already doing, but again, also anything that I can support in terms of my convening role, very happy to help. So just really to understand what you're already doing and where there might be scope to add some more value.
Well, we work heavily with partners across all aspects of our approach. So in terms of victims, we work heavily with supporting victims through a multi-agency approach. Many third sector organisations will support victims throughout the journey of a criminal justice process. We work with other agencies in the preventative space. So when I talked about Project Vigilant, for example, we work with partners in that context. Also, in the context of delivering Operation Vigilant through the nighttime economy, we work with licensing, with local authority partners around our delivery of that. So all across the piece, from the supporting of the victim to the tackling of perpetrators, perpetrator disposals, to the prevention element through Project Vigilant, there's a very heavy partnership element to that. It's a core principle of Sateria also. So again, we're committed to that.
Great, fantastic. Thank you so much. Those were my questions. I think that is the last of the formal presentations. And Freya, it's your moment. We've just got 2 public questions that we're going to put on the screen. One actually relates to the one of the early interventions we were talking about in terms of drugs. And it is about, from Graham and Harrogate, about drug driving. So measures in place, which we did touch on actually in that slide previously, around drug driving, which he is concerned is becoming more acceptable than drink driving among certain people in the community. Just anything that you can add into response to Graham's question.
Okay. Thank you, Graham, for the question. Drug driving is an absolute priority for us. We see the impact of it, and we're committed to tackling it, and we take a very firm approach to tackling it year round. Deputy Mayor, you mentioned Operation Limit earlier on, and we regularly join national campaigns like Operation Limit, which carry out, or see us carrying out, intensified roadside enforcement, particularly over the Christmas period. I think we're actually leaders in this area. And to give you a sense of what we're seeing in terms of demand, in our most recent Christmas campaign, and that ran from the 1st of December 25 to the 1st of January 26, so a clear calendar month, we made 60 drug-related arrests in that period, a rise from 46 in the previous year, the previous month, in the previous Christmas period of 24 to 25. We obviously tested far more than 60 people, but ultimately it was 60 people who were arrested. We heavily invest in preliminary drug wipes for our roads policing colleagues to ensure officers are able to tackle this issue year round. We maintain targeted patrols through our road policing group on high-risk routes across the organisation, across the force area, using intelligence to identify offenders. It's also important to say that through our York and North Yorkshire Road Safety Partnership, we coordinate education and communications all aligned to the national roads policing calendar, reinforcing that message that drug driving is dangerous, illegal, and will be dealt with in North Yorkshire robustly.
Brilliant. Thank you so much. Graham, I hope that answers your question. If it doesn't, send us another one. And then Michael, who is in Burton and Lonsdale, has a question about the inspection report around the police's misconduct processes, whether those failings are being addressed, which I'm pretty sure we've looked at. If we haven't looked at them from 2025, I think we have actually in a previous OPM. And then evidence given to show that they've been addressed, and if whether there are still any issues to be picked up.
So thank you for the question. The answer for Michael is that in the report we had 5 what are called areas for improvement, and AFI. Each area for improvement is then broken down into actions, because the area for improvement might contain a number of smaller actions that sit within that, and that led to 26 actions in total, all of which we have to evidence to be able to confirm back to HMICFRS what we've done for them to close down the area for improvement. So when I talked about the governance for areas of improvement earlier, I talked about the process of us signing them off for completion in force and then them being ultimately closed down by HMICFRS. So all of the areas for improvement, the 5, are showing as completed and closed down bar 2. So they've all been completed by the force. We're just waiting for 2 to be finally signed off by HMICFRS. And in very brief terms, those areas for improvement related to the processes for the collection and sharing and evaluation of organisational learning. They related to the capability and capacity of the professional standards department, the department who investigate wrongdoing. And it was including the way that we respond to complaints and conduct allegations and how we improve fairness and consistency within the investigations within our professional standards department. So those areas for improvement are all complete. As I say, all have been closed off except 2, which are awaiting finding by HMICFRS. Brilliant.
Thank you, Michael. I hope that answers your question. And I'm pretty sure there was an update in the slide pack, possibly the meeting a couple of meetings ago with North Yorkshire Police, if you wanted to see the detail about those measures and the things that have been done to close those down. I think that is it for today. So thank you for everyone who has presented, and to the millions watching online. And our next meeting is with North Yorkshire Fire and Rescue Service on the 16th of April. And then the next meeting with North Yorkshire Police is on the 21st of May. Thank you everyone for their contributions and from our 2 questioners in Burton and Lonsdale and Harrogate too.